Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. So again, welcome everybody to today's program. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. I do want to welcome you if this is your first time attending one of our programs and invite you to visit our website, cscatlanta.org, where you can see a complete list of the in-person and virtual programs that we offer. And I do want to highlight our colorectal cancer support group that does meet monthly. We have put a flyer into the program chat box so you can see additional information on that program. And I also want to highlight a couple other programs we do. We do a monthly nutrition seminar with an oncology dietitian from Northside Hospital Cancer Institute. We do have some really great stress reduction programs like yoga and Tai Chi, and then support groups as well. So again, we invite you to visit our website, cscatlanta.org, where you can kind of see more information on all those programs that are available. As a reminder, you will be on mute for the duration of today's program, but we do invite you to enter program questions into the chat box, which will be addressed at the end of the program with Dr. Garrot and Dr. Fayyadh. I'm excited to welcome today's program moderator, Dr. Garrot, back to this virtual platform. Dr. Crain is a board-certified medical oncologist with Georgia Cancer Specialists. Dr. Garrot received his medical degree from Louisiana State University School of Medicine, New Orleans, Louisiana. He completed his fellowship with Beth Israel Deaconess Medical Center, Harvard Medical School in Boston, Massachusetts. Dr. Garrot has a special interest in general oncology and hematology, with an emphasis on gastrointestinal cancer, genitourinary cancer, and hematologic malignancies. So with that, welcome, Dr. Garrot, and I will pass it off to you to begin today's presentation.
And this is a great forum for us to, interface and educate the community. I did want to say a little bit about Northside Hospital. In the last many years, the cancer provision, the cancer treatments that have gone through and been, increasing through Northside Hospital have been very, very tremendous. And just in the colon cancer world alone, the Northside Hospital is doing more than 1,000 colon cancer surgeries and treating more than 1,500 colon cancer patients, every year. So our volume is high. We have a lot of surgical oncology expertise, as you're going to hear about from Dr. Fayyadh, and radiation expertise and medical oncology expertise. And I'm just one of many. I'm with Georgia Cancer Specialists. We have about 50 doctors. Atlanta Cancer Care, suburban hematology oncology. So there's just this huge resource of cancer provision, cancer treatment that can be provided for the community. And I wanted to sort of highlight that. So we're going to get started with our talk. I did want to let everybody know that there is this chat box. And if you have questions during the presentation, please, enter that into the chat box, and we're going to bring those up, after, and talk about all your questions. Some people will have the same questions, so we're going to kind of group them into, topics that will hopefully address everybody's questions. I did want to introduce my good friend, Dr. Mohammed Al-Fayyadh. Dr. Al-Fayyadh is a board-certified general surgeon, board-eligible colorectal surgeon. He specializes in colon and rectal surgery and utilizes minimally invasive robotic laparoscopic and open techniques. He has unique training and encompasses minimally invasive surgical procedures and believes in individualized care. Dr. Al-Fayyadh is now in Canton, Georgia, and has been there for probably a year now, right? And really brought a high level of expertise to our facility up in Canton. So we're very, very pleased to have him there, and super happy that he's able to go through colorectal cancer for our community. So welcome, Dr. Al-Fayyadh. Really appreciate you making this presentation.
Excellent. Thank you very much, Crain. I appreciate the nice introduction. So thank you, everyone, for joining. And today it will be really more of a relaxed conversation and a talk and education on something that I am very passionate about. And I'm pretty sure Dr. Garrot and a lot of the doctors and team members are very passionate about. So I a lot of people are interested in providing you with, excellent care. So good education really starts about starting to talk about it and frankly talking about it. So next slide, please. I do not have any financial disclosures. And next slide, please. I would like to, start by talking about colorectal cancer. So understanding colorectal cancer and where does colorectal cancer start? So when we talk about colon and rectal cancer, we talk about the cancers that starts in the colon or rectum, which is the abdomen. Colorectal cancer is the third most common form of cancer that is diagnosed in men and women in the United States. And the number of people dying from colorectal cancer has declined over the past 20 years, which is good news in a sense that we are doing better and better early detections and screenings to find these small polyps early and then removing them via colonoscopy. A little note of caution with that is that although the death is decreasing or the mortality rate is decreasing with colorectal cancer, we have seen that the rates among young adults have continued to increase. And then in the past 20 years, really, we have seen people who are less than 50 have noticed a really increase in the incidence of colorectal cancer. Multifactorial, probably related to dietary changes, genetics, lots of things that could be increasing it. But it's absolutely something that we are seeing, and it's something that changed the way that the National Preventative Task Force think about the age of starting colonoscopy, which have recently brought down from 50 to 45. Next slide, please. So many people have no symptoms at all, even if they have colon cancer, that is early colon cancer, because they often occur once the cancer is more advanced in nature. And then if you've already been diagnosed, encourage those that are close to you, family members, friends, relatives, to get screened and get a screening colonoscopy, which is the gold standard to look really at the colon to ensure that everything is normal and there are no findings. What are the symptoms, you will say? Look, what are the symptoms that are associated with colorectal cancer, including change in bowel habits, diarrhea, constipation? And I tell my patients, if you all your life you have a bowel movement every day, and now like you have a bowel movement every third day, or that things have changed in the shape of the stool, more blood that you can see in the stool, things that are different in terms of your bowel habits, abdominal pain, weight loss for no reason, and fatigue, vomiting, things like that, really that would, I would encourage you to get screened. Next slide, please. So we talk about diagnosing colorectal cancer. There are different things that your doctor can do, which would begin with physical examination, examining your abdomen, looking at different things in your body, and then looking and doing a rectal examination to examine your rectum to see if there is any masses that can be felt. But the gold standard, as we said, would be a colonoscopy, which is an outpatient procedure. And I tell my patient is really the best 10 minutes of sleep that you ever get, because it's really like you will have an anesthetist or an anesthesiologist giving you medications that will make you very comfortable. And I tell also that the worst part about colonoscopy is the bowel preparation the night before. It's just to get that cleanse, and which is really important for us to really get all the stool away so we can take a good look at the colonoscopy. There are blood tests that we can do to look for the level of tumor markers in your body that would tell us, if the cancer has spread or not, and different things that we can do. And imaging tests. Imaging tests are important to determine, where is the colorectal cancer. has it spread to other organs? It will determine if it has gone to the liver or to the lungs, which are the two most common organs that it goes to. And that would make it a more advanced stage cancer that would be very important for determining the future treatment options that we have. And then obviously, surgery would be, if we find a tumor, removing it and looking at the pathology to determine the diagnosis. And biomarker testing. So next slide, please. There are biomarkers that we test that are either blood tests or are related to the cancer itself. So you get a colonoscopy and you are diagnosed with cancer. We send this tumor for what we call microsatellite instability testing to determine if there is mutations in the genes with the cancer that would determine your eligibility for certain medications or certain treatment, or if your risk would be an increased risk for having colorectal cancers in other part of your colon. And if you have advanced or metastatic colorectal cancers, ask to be tested for the other genes, BRAF, HER2, KRAS, NRAS, and NTRK, and which is your medical oncologist would be your best resource with these tests to kind of tailor what therapy you would have, because there are lots of advances that are happening with colorectal cancer treatment. Next slide, please. So let's now talk about staging of colorectal cancers. If you get diagnosed with colon rectal cancer, your first question would be, what stage am I? Am I stage 4? Am I stage 1? Am I stage 0? All of these will have implication in terms of the prognosis as well as the survival. And there are 3 factors that determine the staging for colorectal cancer. The tumor size, or like the extension of the tumor, where does it extend into the wall of the colon, which is T, and then N, which is the lymph nodes. The lymph nodes lymph nodes are basically nodes that are in close proximity to the colon where the blood supply goes. That would determine, that would be kind of like the first check or where the cancer cells have gone or spread. And the third one would be the metastases, which is what we talked about, spreading to other organs, including the liver or the lungs or any other organs. But these are the 2 most common ones. Next slide, please. And this is a depiction on this picture. You can see with stage 0, really, it's like really has not extended beyond, it's only found in the inner lining of your colon or rectum. And where stage 1, it really has spread to the middle layers of the colon or rectum. And stage 2 has spread a little bit further into the colon, but has not gone to the lymph nodes or distant organs. And there is like really important distinction between this different stages, because it will determine what kind of treatment you are going to have, whether chemotherapy or no chemotherapy for colon cancer between stage 2 and 3, and then whether, between stage 1 and 2 for rectal cancer, whether you will need preoperative, before the surgery, treatment with chemotherapy and radiation. And then we talk about stage 3 going to the lymph nodes, which you can see, and then stage 4, which really have gone to other organs. Next slide, please. So now let's talk about partnering with your healthcare team. So next slide, please. Your healthcare team is really, previous slide, really include your surgeon, which is, for me, would be really for us and our group and other groups, really would be important to have a relationship with, someone who specializes in your care, who knows what rectal cancer is, who knows the new treatments that are going on. And colon and rectal surgeon involves, having extra training that gets you there to be and really specializing in caring for those patients. And then we work as a team, in cancer care. So we do have bi-weekly meetings with Northside Cancer Institute, with tumor boards that we present, patients' information. We have medical oncologists that are joining, surgeons, radiation oncologists, oncology team in general. You get a whole slew of team members that join, in addition to pathologists as well as radiologists that we review your details, imaging, everything related to the cancer diagnosis to get you the care that you will need, because it's really a team sport rather than like an individual person making your decisions. And there are a variety of support team members that can help you a lot: oncology nurse practitioners, social workers, nutritionists, patient navigators who can help you with navigating the system to kind of get you to get to where you need to get through the treatment journey. Pharmacists, primary care physicians are important because we talk a lot with them to kind of make sure that the remainder of your health is in great health, great shape, that can help you go through the process. And then, of course, financial counselors and making the financial decisions to be important for you. But really, you are the most important person. So whoever has the diagnosis, the patient really is the most important piece in the team, because really you will be making different decisions, and we are all here to support and guide you through that. Next slide, please. So your choice, of medical team, depending on what expertise and things like that. Eventually, my recommendation for anyone who's making appointments and preparing for your appointments with your different doctors, have a notebook. Make a list of questions and concerns you have about what your diagnosis is. What are the things that you are, what are the next steps that are going on that will be in your treatment? Bring a support person. Like when you first get a diagnosis of colon and rectal cancer, like you really will not hear what the doctors are saying, and it's just going to be really important to have like a support person, a spouse, or someone that will be with you that can listen to the conversation and help you make those decisions. And then ask your team members and ask your healthcare team about the side effects and the symptoms that can happen from the treatments that you will get. What are these side effects? How can you treat them? What are the expected complications from surgery? What are the different things that can have implications on your life? And then what are, what medications you take? And then obviously, the same we said about bringing a friend or a relative and asking for copies of your test results, because this will be important going forward. Next slide, please. So you always, you have the right, and it's really, if you get to a point that you want to get a second opinion, please do not feel that you're hurting anyone's feelings. Really, the doctors are there to treat you and they really take care of you. And I'm pretty sure a lot of the doctors would be happy for you to get a second and a third opinion if you need to, if you have questions about something that you didn't understand, or if you want to pursue different treatment options. But talking with different experts can help you feel more confident if you need to. But also, if you don't need to get a second opinion from different specialty, like talking to the medical oncologist, talking to the surgeon, about what the other person would do, and see if these explanations will make sense to you to get you there. And it's never too late to get a second opinion. And don't worry about hurting feelings, because your doctors really want the best care for you. Next slide, please. So you will ask, okay, if I get diagnosed with colorectal cancer and I know which stage am I, what affects my treatment decisions? What are the things that really would be important to consider? And the type and the stage of your colon or rectal cancer really will be important to determine, like we talked about. And then results of your blood tests and biomarker testing, your age, are you younger? Are you 20-year-old or 30-year-old, or overall health? Or are you 90-year-old or 95-year-old, and how is your overall health? And then those are all going to be taken into consideration when talking about the different options. Are you going to be able to tolerate the chemotherapy or the surgery or things like that? And then all of this will be discussions between you and your doctor. And your medical history, like knowing what your medical history has been, know your previous surgeries, because all of these things will be important to determine what the next steps would be. And then also, how are you going to respond to certain treatments? And then what willingness, or are you willing to take, what are you going to tolerate in terms of side effects from the treatment? Next slides, please. So the goals of treatment for any colon and rectal cancer for early or localized disease is really to remove the cancer cells, by surgery, killing them, and then keeping them from returning. The first 2 years after surgery is really the highest risk for recurrence. That's why you would see us really closely monitoring you as you go. And for advanced disease, if it's metastatic that has gone to other organs, is really to slow it down or stop it and manage really your quality of life and manage those concerns to get you to get your goals to match to your healthcare teams, and make sure that you have the important things in life will be addressed. And sometimes, even if you do have advanced disease, surgery is used to cure those patients with colorectal cancers. There's lots of advances in it, and even removing the primary tumor from the colon, but also removing a portion of your liver or a portion of the lungs that will get you to a full cure. And each person really responds differently to treatment, and communication is absolutely key with your healthcare team. Next slide, please. So these are the different types of treatment, as we talked about, surgery, chemoradiation, radiation, chemotherapy, all of these, immunotherapy, ablation, biologic therapy, and clinical trials. All of these really have work in tandem to get us to the best responses that we can get based on previous evidence that we have done, based on studies and clinical trials that we have done. Next slide, please. So you will ask, okay, what is the surgery for colon and rectal cancer? So the surgery, the goal is to remove as much of the cancer as possible, get us a good clean margins by removing the cancer and looking at the lymph nodes that are associated with the colon or rectum. My passion is really robotics and laparoscopic and minimally invasive approach. There has been numerous studies comparing minimally invasive approaches to old-fashioned open approaches that really provide equivalent, cancer surgery and oncologic resections. But really, if you see the robotic or laparoscopic patients with a small incisions, they will recover much faster, and they will have less of the scarring and adhesions that can happen with open surgery. Open surgery sometimes is indicated if you have significant previous surgical history, or if you have really severe presentation for the tumor. And that's really not anything against open surgical approach. But always ask your doctor, is it possible, and ask your surgeon, is it possible to get minimally invasive approaches? Because it will have better recovery and better overall long-term effects by keeping the same oncologic principles and taking care of the cancer. And then what is a colostomy? What is an ileostomy? And you hear about this, and you hear it as the bag. You have a bag to the outside. And sometimes it will be necessary for certain types of cancers, especially low rectal cancers that will bypasses a portion of your colon, or to protect your new anastomosis when we hook you up, and that can be temporary or permanent. And really, sometimes this can be providing much better quality of life than not being able to go to the bathroom in time and having urgencies and things like that. But also, we always understand that it's really significant change in patient's life to have a colostomy and ileostomy. So one of the most important things we discuss is how do we avoid having a colostomy and ileostomy by providing you with great surgery that will prevent you from having to have quality of life issues with bowel function. Next slide, please. Chemotherapy would be, chemotherapy for colon cancer is much better tolerated than other types. And talk to your medical oncologist about the different types and what are the treatment options, what are the drugs that can be used. And for your individual testing, are you going to qualify for certain medications? And what are the survival benefits, or what are the rates of success for different types of medications? And it can be given before the surgery or after the surgery, and it can be given through an IV in a vein or in a pill form. Next slide, please. Radiation, which uses really high energy rays, and that really is used for rectal cancers specifically. And we use that, which is a big advancement in medicine, is to kill and damage those cancer cells by keeping your other cells healthy. And that can be given to basically prevent the cancers from coming back, because it will help do a better surgery, because you will have to remove less of the cancer, less of the tissue. Excuse me, if the cancer has responded based on radiation therapy. And it might be given before, during, or after, which is really mostly and most beneficial if it's given before, because of the significant effects on bowel function. You do have side effects from radiation, which is skin irritations, burn-like skin irritations, pain and swelling and scarring, incontinence and affecting your sexual health and fertility. But really, these are all things that you can discuss with your radiation oncologist, and these are not a must, because most patients don't have to deal with this. Next slide, please. Chemoradiation is basically combining chemotherapy and radiation, and given before surgery to shrink the tumor, mostly for locally advanced rectal cancers. Next slide, please. Targeted therapy, precisely targeting cancer cells and the proteins and genes that are in the cancer cells that help prevent them from spreading. Next slide, please. The side effects from chemotherapy and targeted therapy, talk about it with your medical oncologist, because they will have different medications that can help with preventing that from happening. Next slide, please. Immunotherapy is a similar concept. It mostly helps with metastatic and advanced colorectal cancers. And most recently, probably you heard in the news, with a new rectal cancer treatment, with this new study that they have been doing, that was recently published, that you can really use immunotherapy as first-line treatment for certain types of cancers. Although these are rare types of cancers, for low rectal cancers, and these are still investigational studies, but it really has lots of high promise in terms of what will be the care for us, for our cancer patients moving forward. Next slide, please. And then side effects of treatments, how do you prevent them? How do you talk about them? Take control of the side effects before they take control of you. Talk to your doctor, talk to your medical oncologist and say, what are the different side effects? How can I treat them? And how can they give you a better quality of life. Next slide, please. And managing bowel issues. After having bowel function, are you going to have obstructions or perforations by the cancer or the treatment? These can be emergencies that can be treated. But also you can have nausea and vomiting, bloating, or inability to pass gas, constipation or diarrhea, and loss of appetite, which can give you an indication that things are not really going the way that they are supposed to. And increasing water intake, having good healthy diet, increasing fiber intake, these are all things that can be helping if all of these other symptoms are not present. Next slide, please. There are clinical trials for, like, if you get to a point that your treatment is not responding, so join a clinical trial. Find a place where you can have a clinical trial that can provide you with new treatments and things that can help you help you in your individual situation. And every doctor does not have the same trials, and then find different places that can have you join someone. Next slide, please. Palliative care. So palliative care is really an important concept in any cancer diagnosis. Palliative care focuses on providing cancer patients with relief from symptoms, pain, stress of serious illness. And really, palliative care is appropriate for a patient of any age and any stage, because palliative care is not hospice care. Really, it can help you guide your treatment in terms of what are important things in life for you. What are the goals of care that you like to address? Next slide, please. This slide talks about follow-up. So if you are diagnosed with cancer, what are the follow-up recommendations, including every 3 to 6 months for the first 2 years, and then every 6 months until 5 years. There is physical examination, blood tests, CT scans that could likely happen every year or every 6 months if it's high risk, and then colonoscopy, which also will be surveillance colonoscopy to ensuring that your cancer doesn't come back, because it's the highest risk of recurrence is the early stages of cancer, like early years after cancer therapy. Next slide, please. And then now, this is an important and mostly forgotten topic that really is really important for cancer patients. How do you cope with cancer? So you get all those treatments, you talk to all these doctors. What are the things that are important in life? How do you live your life? What are the different difficult subjects that you need to talk to your doctors about? Find a healthcare team member that you trust, that you can talk about, that you can ask for advice, or that can provide you. Regarding sexual health and fertility, are you in the age that you are planning on having biological children, which you haven't had yet? There are different options. Talk to a fertility specialist. Sexuality. So talk about sexual health. You can trust and ask those questions. And sexuality comprises a broad range of feelings and actions that really can be affected by different treatments. Next slide, please. And then quality of life, physically and emotionally, how can you live? Because set up goals for things that are really absolutes that you have to have, and certain things that are nice to have. Feeling sad, alone, angry, anxious, or overwhelmed, or distressed is common. You're not the only one that is going through this. And there is lots of people who are doing the same. So ask people, talk to other people who have gone through it, talk to support systems that can help you navigate that. And we are here for you. Next slide, please. Emotional wellness. Do you have persistent worry? Are you having difficulty sleeping? Are you feeling nauseous or experiencing accelerated heartbeat? Some of these questions are important to ask yourself to see if you're experiencing anxiety, and talk about it. It's okay to let go and feel bad for, why me? That's okay to ask. Next slide, please. Ask about, see if you are experiencing depression. Do you cry often or uncontrollably? Have you lost interest in things that used to give you pleasure? And are you eating and sleeping more or less than you used to before? Talk to your doctor about that. Next slide, please. Find supports. There is lots of supports, like the community support we have here. Learn from others. Like if others are going through the same thing, they will tell you different tips and tricks of things that they have done that help them. Learn coping strategies. Feel less alone and manage anxiety and learn about resources. Next slide, please. And then strategies for wellness for anyone who has diagnosed, or even if you don't have colorectal cancer, I recommend that you do this. Physical activity, eating healthy foods, drinking lots of water, healthy foods, increasing fiber in your diet if you can, and creating a personalized care plan if you do have a cancer diagnosis of what are the things you need to do to prevent things from happening. Next slide, please. And tips for caregivers. Really remember to take care of yourself, because it's really tough for you and for them, for whoever has the cancer diagnosis, your family member, your loved one, and talk to others to support you too, because really you need to take care of yourself to be able to take care of each other. Next slide, please. And then talk about practical considerations. Really, talk about finances, insurance, legal matters, employment. These are important concerns, so keep records of all expenses. Work with an attorney to draft a will and have a medical power of attorney if you get to the point that you really cannot make that. Next slide, please. Next slide, please. So cost of care, if you go back one, what are the important two questions to ask about cost of care? What is the financial impact that my cancer diagnosis will have on me and my life? And am I able to coordinate the financial piece of my cancer care right now? Ask your doctor, because really you have lots of resources, and especially Northside Cancer Institute have done a really good job to help you navigate that with oncology social workers, financial counselors, any nonprofit organizations, or organizations that can help you manage those financial concerns. Next slide, please. And we talked about the legal documents, wills, and then the power of attorney. Next slide, please. So these are really great cancer resources, so Cancer Support Community of Atlanta, really I thank them for the great opportunity to talk today. And you have lots of good resources, American Cancer Society, Cancer Support Community, Colorectal Cancer Alliance, Fight Colorectal Cancer, National Cancer Institute. There is lots of people who are really passionate about this, to help you, provide you with accurate information that help guide you through this process. Next slide, please. So with this, I really thank you everyone for coming today, and I really do thank Dr. Garrot and Katie for this opportunity. And please let me know if you have any questions. I'll be happy to answer. Thanks.
Dr. Alfrey, thank you very much for a great presentation about all the ins and outs of colon cancer. That was very thorough. I know that there's a lot of questions that have already been submitted, but I would want all the participants, even now, if you have questions, to submit via the chat box, which we can see, and we'll go through. A couple of things that came in already. How does a family history affect the recommended screening ages for colorectal screening?
Absolutely. That's a great question. So it really does affect colorectal cancer screening. If there is only so first talk to your doctor about the family history and specifics about the family history. If there is someone in the family that had colon cancer, really the age for screening colonoscopy should be 10 years prior to the age that the youngest age that the cancer was diagnosed. So if they were diagnosed at age 42, their immediate family members should get colonoscopy at age 32. If they were diagnosed at age 50, you get at 40. If you were diagnosed at age 55, you also get it at 40 because you want to start early. And if you have any symptoms, you get really a colonoscopy really sooner than that. And there are different genetic syndromes that really even we start from age like really young ages that you really have to talk about. But that's a great question.
There's another question. Let's see, I'm trying to collate these things. About screening, one of the questions from the audience was, is it true that African Americans should be screened at an earlier age? Are there age differences for African American population?
Yes, there is, because of the increased risk for colorectal cancers. There is higher risk in African American patients. Therefore, earlier ages really would be necessary. The old recommendation when the colonoscopy was age 50 for everyone, really African Americans should get it at age 45. So now when the age is 45, you should get it at age 40. And even, sooner if you have a family history.
Just continuing on with the screening motif, one of the questions was, are the at-home testing kits a reliable resource for screening, such as Cologuard? I don't know if there's other products besides Cologuard, but I think that's the most common one.
Right. There are other products, and really, it's like a field for, it's really under development, but really have had some good successes in certain things. But really, even if you get a positive Cologuard or positive test like this, the gold standard that has to follow would be colonoscopy. Colonoscopy really is the gold standard, because really we can look with our eyes, we can see with a camera, and really remove the polyps at the time of your colonoscopy. And at the same time, the downside with some of these tests is that they detect advanced adenomas and colorectal cancer when it's already too late. We do want to find the colon polyps when they are early to take them out. So, if you tell me that you're absolutely not getting a colonoscopy, I would say just do the second or third best thing, which is these tests. But really, strongly recommend getting a colonoscopy.
And I'd like to second that too, just from our experience in the medical oncology world. That whenever we see our GI doctors doing colonoscopies, they're seeing the polyps and they're removing them at the same time. And so, what that has done over many decades is decrease the incidence of colon cancer from back in the 80s when it was higher. And one of the theories is that removing the polyps is actually taking out the potential seeds for future colon cancers. And almost all colon cancers come from a polyp, but not all polyps turn into colon cancer. So doing a screening colonoscopy at 45 and removing one or two polyps could be removing a polyp that hypothetically could have progressed within years to becoming a colon cancer. So that's one of the other values, is there is some, minor component of actually reducing the chances of future colon cancer by taking out the polyps. And that's what I advocate for my patients to do. And I agree with you when you said the prep was the worst thing. I've had a colonoscopy several years ago, and the prep was no fun. You have to, drink all that material, and you end up excreting a lot of material, to say it nicely. And then when you go in for your colonoscopy, they give you the medicine and it makes you go asleep. You are asleep. You are not awake. You do not experience any of the effects of the colonoscopy. I think afterwards you have a lot of gas. You have to pass a lot of gas that they insufflated into your colon. But the colonoscopy itself is actually a very, you don't even feel it. It's a very easy thing to do. So right. I've always told people that. And I have a little phrase that is kind of funny. I hope it's not offensive to anybody, but I came up with this several years ago when we were advocating for colon cancer screening with the American Cancer Society. I said, if you do the prep and you poop your brains out for 8 hours or 12 hours the night before, it could save your life by finding a colon cancer. So at any rate, a big kudos and to your recommendation for the colonoscopy. I think all the medical oncology and radiation oncology practitioners would echo that. So then another question that has come through is about a patient who has been diagnosed with colon cancer. Should they look into a resource for genetic counseling? And what are the advantages to my family receiving genetic testing?
Yes, absolutely. Because there are certain, depending on the age and depending on the family history, there is a lot of things that you can talk about. But the Northside Cancer Institute do have genetic specialists that can help guide you through like the different visits, and then can provide you with testing that you really can find, like, do I have really a syndrome or like a genetically inherited cancer? And this really will provide you and your family with lots of useful information to look for other types of cancers, or even for colorectal cancer, to see what the risk is for them.
Yeah, and I think that one of the other things that happens to all patients now with colon cancer is when the pathology from the surgery is analyzed, they are automatically testing for 4 different proteins that would indicate, if those proteins are not present on the pathology report, that there would be a genetic predisposition. And so all of those patients are seen by genetic counselors who are genetic specialists to determine if they have a genetic syndrome. And they would have whole body, what we call germline testing, through either a blood test or a saliva test, to see if the genes that predispose them for colon cancer are throughout their whole body. So not only is the tumor tested, but the patient is tested when those tumor abnormalities are present. And that's kind of consistent across the board with all colon cancer samples. So as far as other, here's a question that's a bit salient to surgery. What factors determine if my colonoscopy bag will be permanent or temporary?
Oh, that's a great question. So depending on the distance that we are from your anus when we remove the cancer. So if there is enough room for sphincter preservation, which is colorectal surgeons, this is most of the training that we do, is really how to preserve the sphincters and provide you with the best function. So if there is the cancer is involving the sphincters, there is, we can't really save the sphincters at that time, because really we have to get all the cancer out. And that will make a colostomy permanent. And then the second thing would be like a temporary ileostomy or a colostomy can be used to get you as a bridge, to get through the treatment if you come in with an obstruction or not. Or after surgery, if you remove the rectum and you're all the way, you have a low anastomosis that can increase your risk for leakage. If the anastomosis don't heal, the colon and rectum don't heal, you can get really sick. So we try those higher risk anastomoses, especially after radiation and chemotherapy treatments. We do a diverting loop ileostomy that can stay for about 3 to 6 months, that can protect you from having the severe issues with anastomotic leak.
So another question that came through from the audience is, what is HIPEC, and when do we use HIPEC for colorectal cancer?
Basically, hyper. So it is the most benefit that has been seen really is with appendiceal cancers, because where the appendix has cancers to it, and then you do debulking, take out a lot of the tumor, and then put high temperature chemotherapy inside your abdomen with surgery to get rid of a lot of the cancer. Colorectal cancer really has been not shown to have really a clear benefit, but some centers are doing that. They are doing HIPEC for colorectal cancers. The benefits are not really very clear, but absolutely it's a more advanced peritoneal recurrence of disease, and it has to fit a certain criteria to qualify for that.
Another question that was a pre-submitted question was, what factors determine if it's best to have radiation therapy or chemotherapy or both prior to surgery or rectal cancer?
Absolutely. That's a really important and evolving discussion. The factors really are the staging. What stage is your cancer? Stage 1 rectal cancer does not need radiation or chemotherapy and can go straight to surgery. But if it's more advanced stage, you will require that to prevent, because it has been shown that it decreases the risk for local recurrence as well as distant disease from rectal cancer. And there are really new advances in care in terms of giving all of the therapy up front, doing total neoadjuvant therapy and certain things. And even there is, few centers, that you can, that has published really good studies about a certain percentage of patients that have complete response, that the cancer goes away after chemo and radiation. There is an option of not having surgery, but having intense surveillance to look for the cancer coming back. It has its risks. The cancer can come back and can come back at different stage, more advanced stage than when it started. But it's absolutely a discussion to have with your surgeon. Is watch and wait after chemo and radiation an option for me? And is it not?
Gotcha. Thank you. One other question that kind of came through is intravesical therapy for colorectal cancer used the same way that it's used in treating bladder cancer?
Intravesicular chemotherapy really is used only for bladder cancer. It's not. And you, Crain, probably you can answer this question even better than I am.
Well, the thing about the bladder is that it's basically a balloon in your pelvis, so you can put medicine into it, whereas the colon, it just goes from one end to the other, right? So you can't really put medicine directly into the colon. So we do not use any kind of, infused therapy for cancer within the colon itself. It's all given through the blood. That's what I do as a medical oncologist, is deliver the chemotherapy for colon cancer. So we wouldn't do anything like that for colon cancer. One other question that came through was, do we ever do genomic tumor profiling on anal cancer, which is a squamous cell cancer, different than colon cancer? Is there any role for genomic profiling for anal cancer?
It's not as different types of viruses can have implications on which type of cancer that happens. And there is some genomic testing that can be done. But most of the treatments for anal cancer is really much different than colon and rectal cancer, and really is mostly chemotherapy and radiation therapy rather than having to need surgery for it.
And also, since the anal cancer is more exposure-related cancer, there's not a lot of genomic abnormalities that lead to anal cancer. It's definitely not heritable. So we don't do the genomic alterations. Now, I will tell you that for a patient, a rare patient who is not cured from anal cancer, then we do what we call next-generation sequencing, which is sort of a standard thing for most cancers nowadays, to look for any molecular abnormality that we can use to treat the cancer. But that's not to look for something within the germline that goes from generations. That's looking for if a patient happens to have a mutation that can be exploited as a treatment option. And that's a very common practice for almost all cancers. So that's not unique to anal cancer. So I can help with that one. There's no other questions that I had seen come through, but I wanted to ask a question, and maybe you could sort of walk us through in a couple of paragraphs what usually happens to a patient during the surgery, because you do a lot of minimally invasive surgery, so you're using the robot perhaps, and people may not understand the robot. And then what happens to them after surgery? Because a lot of folks are scared of surgery. It's obviously a big worrisome thing. You go in anesthesia. And so, I have taken care of hundreds, if not thousands, of patients who have gone through surgery, and, they're fine, they do great. But before the surgery, people are always very apprehensive and scared. So maybe walk them through, what happens during the surgery and right afterwards.
Absolutely. Thank you, Crain. This is a really great question. So really, people are apprehended because of the new diagnosis of cancer, and you are anxious and worried. But really what you need is really a surgeon and a doctor that can walk you through the process. So you come into my office, we talk about, okay, here's what the diagnosis is. Here are the things we have to do before going to surgery. And here are the things that we have to do in surgery to what are the different a colon that will have to be removed. Well, location for the tumor really determines what portion of the colon will be removed. And with minimally invasive surgery, so you come in with me, you have 2 visits. So you come and see me the first time, you come to see me the second time because I want to make sure that all your questions are answered. And then you go into surgery. You will talk with lots of people to prepare you to get to there. And then you will be asleep for the procedure. For the robot, basically what we use is small incisions, that is 8 millimeters, that's even less than a centimeter for each port, that we can place few different ports that I can look with really high definition camera, and I have very fine precision to really get rid of the cancer in a really way that can be very gentle to the tissues and really to remove the cancer cells by protecting everything else. And then I put the colon and small intestines together, and then you will be recovered. In the hospital, 2 to 3 to 4 days in the hospital until the bowel function returns, and then 2 weeks until complete recovery. And then really, minimally invasive surgery. Really, a lot of my patients are not even using lots of narcotic pain medications afterwards, just for few days after, and then eventually they can go back to their activities slowly until they fully recover.
And from my side, I don't ever do surgery, but the patients will come back and see us. And the patients who undergo minimally invasive surgery, like you're describing, generally have a few small Band-Aids, not a big incision. They don't have the big zipper with the staples and things. And their pain levels have been much lower. There's seemed to be a lot less need for blood transfusions from blood loss during surgery and things like that. So there's so many parameters that have been made better in the surgery for these cancers that you guys have been doing. And it's just fantastic. From a medical oncology standpoint, you see a patient come back and like, hey, yeah, I had surgery last week. And they feel great. So kudos to the field and you and your colleagues for providing this, exceptional care for our cancer patients. So I don't have any other questions from the audience. And we've gotten to about a little after 1 o'clock. So if there's any other questions, maybe you can submit that right now. But I really like to thank Dr. Al-Fayyadh for making this presentation, for being such a wonderful doctor. I've been working with you for about a year, and you're a fantastic clinician. And you brought a wealth of expertise and awesome cancer care to Northside Cherokee, where I practice as well. And I look forward to many years of being a colleague of yours up at Northside Cherokee. So thanks again, and hopefully we get to do this again for the community.
Thank you, Crain. Very kind of you. Thank you very much. Same.
Thank you both.
Katie, do we have anything else?
I think that's it. I just want to also let folks know that I put in a link into the program chat box. If you could take a few minutes, just please complete this survey on the information shared. It kind of just helps us tailor the information and make sure it stays relevant to this community. So please take a few moments and complete that. Even if you're a healthcare professional, we ask that you do. And also, again, we're going to have our colorectal cancer support group meeting next week, and that's currently meeting virtually, but we do invite you to email Emily Brown. You can find her information on our website, cscatlanta.org, and she can connect you to that group. So I think that's it. I also want to plug that we will be having a recording of today's program up on our website. So if you know anybody who wasn't able to attend the live program, they can find a recording on our website as well. And it looks like maybe I got some feedback the link isn't working, so let me try to enter that back in. But I think that's it from my end. I'll put that in a second.
Excellent. Have a great day, everybody.
Thank you very much. Bye-bye.
Bye.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs. Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
So we're going to cover a few topics today. Really what I want y'all to get out of this is feeling confident as you go through the grocery store. The first thing we're going to talk about is how to, look at a food label. See, they recently updated it. So what are the new things that they're highlighting on the food label? We're also going to talk about organic foods versus non-organic foods. What does that mean? What does the different labeling mean for those? We're going to talk about how to build a healthy plate. So when you're shopping, how to know if you've gotten the different components of your plate to make it healthy and well balanced. We also are going to identify cost-effective options in all the different food groups and categories of the grocery store, so that you might learn something to look out for next time you're shopping. And then finally, we're going to review just some grocery shopping tips as well as some food safety tips while you're grocery shopping. So recently, they redid the food label. These are found on all of your packaging as you shop. The old food label was about 20 years old. And so as you can see from the picture, starting kind of at the top of the nutrition facts label, the serving sizes are in bigger, bolder font. It's typically going to tell you in that box of pasta or cereal box that you get, how many servings that you would have per that container. The other thing to look out for is in bold below it is actually what the serving size is. That does not mean that that's the only serving size that you need to eat at the mealtime, but that's just telling you, hey, we base these values that you're going to see below off of this picture, 2/3 of a cup. You can see that the calories are listed in bigger, bolder font at the top. So that's again going to tell you the calories per serving. And let's say you wanted to have a double serving of something, then you would just multiply that by 2. Finally, there's also there's an added sugars component. So we're going to talk about how to identify those and what is considered an added sugar here in a minute. It also talks about the different nutrients and nutritional value at the bottom you can see it highlights various things, whether it be vitamin D, calcium, iron. And then they actually, in the past, they kind of left it as like a wider range, bigger variety upon the percentages, but now it actually tells you the actual percent for your daily value. So first, we're going to look at each different kind of section on the food label. We're going to start with the carbohydrates, or as a lot of people call them, carbs. They are your primary energy source for your body. Basically, any sort of carbohydrate is turned into glucose, which is what your body uses for energy. There are 3 types of carbohydrates: fiber, starches, and sugar. And then on the nutrition facts label that you can see on the side of the slide, the total carbohydrates encapsulates all 3 of those types of carbohydrates. So it gives you the total carbohydrates, which, as you can see, this product has 37 grams. It gives you the amount of fiber, which you always want to look for something, especially in your like whole grain, whole wheat products. High fiber foods are good for heart health and gut health. So that's always something important to look for. It also will give you the total sugars. And then that will be your natural sugars as well as your added sugars. So you can see underneath the total sugars, it tells you how much added sugar there is in that product. So to kind of go more off of the added sugars, if there are many different, these are the sugars that have been added to the food to make basically for taste or flavor. basically, their added sugars come in many different names. You can see agave nectar, corn syrup, honey, dextrose, fructose, or sucrose. So it can be a lot of different things. And I don't want you to have like a fear of not purchasing a product because of the added sugars. But if you're trying to watch your blood sugar control, if you have diabetes, or if you're just looking for a product that has less added sugars, then that would be something for you to look at on your ingredient label. But one kind of side note is that the American Heart Association does have guidelines for people for added sugar intake for heart health. For men, as you can see, it's no more than 9 teaspoons a day. And for women, it's no more than 6 teaspoons a day. So that's just something to be mindful for heart health. Now, as we kind of keep going down the food label, there's also some products may have protein in them. Protein is good for a lot of different things in your body, such as like repairing cells, muscle support. Protein is your longer lasting energy in your body. So your body's going to use a carbohydrate a lot faster than it would a protein. So when you do build a meal or a snack, it's important that you have some sort of lean protein or plant-based protein as part of your meal or snack. So the proteins listed towards the bottom, and, you know, kind of a rule of thumb or generalized guideline would be about 20 to 30 grams of protein per meal. But each person's different. So, you know, always feel free to reach out and you can work with a registered dietitian on that. And then we also, fat is another category that's listed on the product food label. There are a lot of different types of fat. So as you can see under the fat category, this has examples of saturated fat, trans fats, and cholesterol. Now, cholesterol isn't going to contribute to any calories, but it is something to watch if you're being conscious, again, kind of about your heart health. You want to mainly focus, and the types of healthy fats that you want to incorporate into your diet are going to be your unsaturated fats. So if anybody's ever heard of like, you know, omega-3 fatty acids, those would be like your salmon, a lot of your fish, your like olive oil, or omega-3 fatty acids are found in nuts, walnuts, almonds, things like that. So those are going to be your healthy fats. Now, I think, you know, one of the kind of main things I wanted to talk about was like, as you're going through the grocery store, it's hard a lot of times to see, you know, marketing companies are really good at putting like eye-catching phrases out there. So a lot of times you might see one, I'm going to use cereal as an example, a box of cereal that says 100% organic, or you might see another one that says made with organic ingredients, or you might see a product that says 100% natural. So it can be very confusing at times to decide like what's best for me, what product should I buy? So the next few slides, we're going to talk about what each labeling kind of means, hopefully, so you can use that when you're at the grocery store next time. So you might have seen this USDA organic sticker before on certain items. This is something that's regulated by the USDA. And as you can see, there are a couple different certifications for something to be considered or to not be considered organic to get that green seal of approval. So first, if something's 100% organic, then that means all the ingredients are certified organic. Any processing aids must be organic, and product labels also must state more information than others. This also can use the green USDA organic seal. Now, if you have something that just says organic, it also can have this the green USDA seal, but if it just says organic, then that means at least 95% of the ingredients and processing to make that product is organic. So that's why it can use that green seal of approval as well. Now, some products may say that they're just made with organic ingredients. So this means that at least 70% of the ingredients are certified organic. So this would be like, maybe, I know I keep using cereal as an example, but it's just kind of easy because there are so many different varieties out there. So it may be that the cereal has organic oats in it and organic like nut clusters, but the other parts of the cereal are not organic. So it cannot use the green USDA seal of approval, but it can still say that it's made with organic ingredients. And then if it just has specific organic ingredients, like, you know, if it says made with organic flour or made with organic almonds, then that's just kind of an ingredient listing. And then in the actual ingredient list, it'll tell you. You know, I bring this up because it, like I was saying a minute ago, just because something says organic on the label doesn't necessarily mean from like a calorie, a fat, and added sugar perspective, it's healthier. It's really about like the processing of the product and the way in which the ingredients were grown. That's what makes something organic more beneficial. So now, like we kind of talked about, okay, you're at the grocery store and you've looked around and you've gotten your ingredients, and I kind of alluded to this earlier, it's important that when you are planning your meals or you're preparing your snacks or trying to think of, I'm sitting down to make my grocery list for the week, how do I make sure that my diet is balanced? How do I make sure that I'm getting everything I need? Well, the kind of old school and like years ago, not too long ago, there was the food pyramid, and then you had like the My Pyramid, and it kind of had all your different food groups listed. But now things have shifted more towards a balanced plate. This is more like visually appealing, and you can kind of visualize what your plate needs to look like. So as you can see on the slide, you want half of your plate to be non-starchy vegetables. And then in the next couple of slides, I'm going to go over some examples of those. You want a fourth of your plate to be a grain or starch. And specifically, you want that grain or starch to be whole wheat or whole grain. And then you also want a fourth of your plate to be protein. And with that fourth of the plate protein, you want to choose either like a plant-based protein, such as like beans or peas, or some sort of lean protein like a salmon or chicken, things like that. A lot of times, you know, and then this also has an example of fruit as a side, which is a great way to add some extra fiber, some extra vitamins and minerals into your plate. So the biggest thing is, you know, I kind of think about a lot of times if we go out to eat, sometimes that top half of the plate might be what is served for our pasta portion and then a little green side, but really you want to flip it and make sure half of your plate is some sort of non-starchy vegetable. It doesn't have to be one. You could do half of a side salad and maybe some sauteed veggies on the side. So now kind of like picture yourself somewhat, we're going to go around the grocery store to the different kind of sections and categories. And I am going to kind of go over what to look for when you're shopping. And we'll kind of go from there in the different food categories. So with your fruits and vegetables, it's easy to get stuck in a routine of just like a side salad or, just something easy. So these are some suggestions of ways to kind of think outside of the box to help get some more of those fiber-rich fruits and vegetables into your diet. So if you do have a dipping sauce like a salsa or hummus, guacamole, try to use the actual like veggies as your chip instead of getting a chip or a pretzel, or you can do a combination of a few things. Also, it's best when you're shopping if you do not. I know that the pre-made, pre-chopped vegetables and fruits are convenience items, but you're most likely paying more for those because they are already processed and chopped. But also, once something's like cut and prepared, it starts to lose its nutritional value. So it's actually better if you can buy like, say, a bunch of grapes, bring them home, wash them yourself, and then put them in the refrigerator instead of buying something that's pre-done for you. I know that it may be difficult, like if you, like right now, watermelon's in season, and it's really convenient if you just buy like the small little container of watermelon, but sometimes that may be double the cost of an actual whole watermelon. So it may be that you have a neighbor or a friend that you can split it with, or, try to find some new ways to utilize the extra produce that you have. Grilled fruit, especially like peaches and plums, any kind of stone fruit or pineapple too, is a great way to make a dessert. So if you are grilling out, throwing some of the stone fruit on the grill can be an easy dessert. Veggies, especially if you have leftover veggies, are a great way to use for pizza toppings. And then also, frozen produce is just as nutritious as fresh. So, any of those frozen produce or microwave bag, or the produce that come in the microwave bags, those are perfectly fine to keep on hand to help you as you shop. Topping a baked potato to kind of make that the center of your meal, or topping a sweet potato can be a great kind of easy way to utilize some extra veggies in there too. And then fruit is also a very easy thing, whether or not you're having yogurt, oatmeal, cereal, just throwing a handful of like frozen blueberries on your breakfast. That can be an easy way to get in a little bit extra fiber and those vitamins and minerals as well. And then omelets are also a great way to use veggies too. So these are just some examples of your non-starchy vegetables like that I was talking about, trying to build half your plate from. And then you also have your starchy vegetables. Now, I think there's a common misconception that people should avoid like sweet potatoes or any sort of starchy vegetables. And that actually, like, we actually really do encourage you to do those starchy vegetables as a balanced meal or snack. It's all really about getting a lot of great color variety in your diet. And so some of these things like, your sweet potatoes, your pumpkin, your butternut squash, those are really that rich orange color, which has beta carotene in it. And that's really good for you. So I'm going to leave you all with some challenges at the end of this, but maybe take a note while you're looking and try to see if there's some sort of non-starchy vegetable on here you haven't cooked with before or you haven't tried. So we talked about produce. So now thinking about like the bread aisle, as well as your grains or cereals, or even just, general kind of like starchy foods. The biggest thing to remember with this is you want to choose something that is a whole grain. So the first ingredient on the back of the bread label would say 100% whole wheat. That's your like key kind of takeaway of what you want to look for when you're looking for bread or like a wrap or pita or anything like that, a dinner roll, something like that. You just want to make sure that the first ingredient says 100% whole wheat. For your fiber per serving, if you want something that's higher in fiber, if it's greater than 3 grams per serving, then that's going to be something that's considered high fiber. And again, back to like the initial slide, it would be located under where the carbohydrate section is. Now, there is a kind of misleading claim that multigrain sometimes does not always mean that it's 100% whole grain. Multigrain just may mean that it has a bunch of different types of grain in the product, but they still can be refined. Refined means that they're just processed a little bit more than something that's whole grain or not refined. Another challenge to do is to try to find a grain you haven't cooked before. Quinoa, it's spelled Quiona. Yeah, quinoa is a really great grain that cooks just like rice. There's also bulgur and a lot of different things that you might have seen before, but not necessarily tried. So I think that's also a fun little challenge to try to find a recipe for that too. And then, finally, sometimes if you buy your grains in bulk, so if you just buy like a bigger bag of brown rice versus the individual packages, that can be cost savings in the long run because, again, like the fruit, you aren't necessarily paying for the extra convenience and packaging of the product. So as you go to shop for like your deli meat, or like you're going to the deli or like the meat counter or anything like that, the American Institute for Cancer Research does have a couple of guidelines pertaining to the type of protein that you consume. It's recommended to limit your red meat. So that includes beef, pork, and lamb. I know pork is advertised as the other white meat, but it is considered a red meat. They recommend limiting your red meat consumption to less than 16 ounces per week. So a serving of red meat or a serving of protein is about the size of a deck of cards or the palm of your hand. So that'd be about 4 servings per week to limit of your red meat. The AICR does encourage your consumption of lean proteins and also of plant-based proteins too. So when we're talking about plant-based proteins, it's okay if you want to buy canned beans. A lot of times we don't have the time to cook dry beans all day. So if you do buy your canned beans, just try to buy the low sodium or sodium free, just to prevent you from consuming extra salt in your diet. And then finally, you do the other recommendation from the American Institute from Cancer Research is to limit your processed deli meats. These deli meats contain nitrites and nitrates. And so a lot of times you find that in like your breakfast meats or like your deli meats that you might, like your turkey or ham or whatever that you get for lunch, or in hot dogs too. They do make some products now that do not have the nitrates or nitrites added in them. Typically, like a keyword on the package would say all natural or no nitrites or nitrates. But if you can, it's best to just avoid any kind of processed meat. And then also just, like we were talking about with the beans, you can purchase like bulk frozen or bulk fresh lean protein like salmon or chicken. Like if you bought like a bigger pack of chicken And then you can individually freeze the breasts to pull out one at a time. And sometimes if you buy in bigger bulk, then the cost can go down. So these are just some examples of different types of high quality lean proteins that are found out there. For instance, like if you have a salad, if you throw some chickpeas or garbanzo beans on it, that's a quick, easy way to add some protein to something. Same thing, like if you were making like if you had a vegetable soup, adding some beans to it would be an easy way to make it a complete meal. Then we also have a lot of different fish examples here. You can see it's recommended, if you do like fish, to try to do like 3 to 4 servings a week. You do want to try to limit your fish that are high in mercury, which are typically like swordfish and some of your like bigger tuna. But I think there's different ways, to incorporate lean protein in the diet too. So then, like, as you're shopping around, a lot of times when we're cooking, there are so many different like oil options out there these days. It can get confusing as to like what type of oil we need to be cooking with. So olive oil is high in omega-3 fatty acids. It's best to cook with it at a low or medium temperature. And then canola oil or avocado oil can be used to cook things at higher temperatures. So it's just like they just don't break down as fast as olive oil. So if you're going to saute something, then the olive oil would be fine. But if you're going to do something at a higher heat, then like the canola oil or olive oil would be your better choice. Also, you can see there's some examples of some nuts and seeds that are listed as healthy fats. Making your own trail mix too may be an easy way to get in some of those nuts and seeds versus if buying something that's already pre-made. And then you can kind of tailor it to what things you personally like.
Mayor Parker, we have a question on what your thoughts are on coconut oil.
So coconut oil does have a higher saturated fat profile. So I think, the recommendations are just to use it sparingly with your cooking, but it is a, acceptable cooking method. Does that help answer? Because I know some people like to pair it with certain like vegetables if you're sauteing for the flavor.
She did say yes, thank you.
Yep. I would just limit like some people will incorporate it more so like on a daily basis. So I would just use it sparingly in your cooking because it is high in saturated fat.
Did have another question about nuts.
Yeah.
I love nuts and would eat them every day, but they seem to cause constipation. Do you have any thoughts about that?
So unfortunately, everybody's GI tract is different. A lot of times it may depend on the quantity of nuts that you're eating or the type. Nuts are high in fiber. So to be honest, I unfortunately don't have a specific answer for that, but you may, if you compare it with if you compare your nuts with like some dried apricots or even maybe like a dried prune as like a trail mix type thing, that may balance each other out just so that you don't have that GI issue.
Good idea. Thank you.
Yeah. So since these are just some like smart shopping tips that I've kind of talked about as we've gone through. But, it's important that when you're grocery shopping, you go prepared. It might be something where you can keep like if your refrigerator is magnetic, or if you have like a area nearby where you can write, okay, I'm running low on nut butter, so I need to make sure to get that, just so that when it's time for you to grocery shop, you actually have kind of a tool to sit down and think about like what you need, and you won't get home from the grocery store and be like, oh gosh, I forgot to get the peanut butter because I forgot to write it down. So I think it's just being prepared and knowing what you need to get when you go. Another tip is to avoid going to the store hungry. When we grocery shop and we're hungry, we tend to grab the things that we want that we might not necessarily need. So you may walk out of there with some extra, some extra treats in your cart that when you get home, you might be like, well, I don't know why I bought this because I don't have a use for it. So that's kind of, you won't end up spending money on non-essential items. Again, we've talked about buying in bulk. If you're able to do that, sometimes like the cost per serving is a lot less if you buy it in a bigger container as opposed to the single serve pouches or individually packaged like protein. Again, try to limit your like pre-chopped or convenience style items just because you're paying for the extra cost for the grocery store employee to prep that. Also, you're just the produce might start degrading by the time you get it home. I also would recommend with like your meat at the meat counter, they do sometimes have stuff that's pre-marinated for you, but it's best if you can just get it home and marinate it yourself. Just again, from like a food safety perspective, that way you kind of know that this, whatever it is, has been in a sealed package and you brought it home and you marinated it yourself. Also, seasonal produce can be a lot more affordable than out of season produce. So sometimes it may be beneficial to kind of shop in season. And then finally, buying generic brands or buying like store brands sometimes can be more affordable than buying name brands. And they're going to pretty much be the same thing. It's just you're paying for the extra couple cents for the name brand compared to something that's generic brand. And then kind of the last thing I wanted to talk about was just some food safety tips when you are grocery shopping. Inspect your food packages. Just make sure that things aren't dented or, especially with canned goods, you don't want them to be dented or bulging. If anything's supposed to be sealed as far as like produce, you want to make sure that it's sealed. Shop in order. I've gotten to where I like to write down my grocery list in order to where the perishable items I'll get last. So anything that's frozen, anything that needs to be cooled, get that last so it doesn't sit in your cart for too long. Also, getting your produce that you're only going to try to eat over the course of the week. This helps to prevent you having to throw away excess stuff. And then also, you just don't want something sitting in your refrigerator for too long that could potentially kind of grow stuff on because it is fresh. And then I know a lot of people use reusable grocery bags, but it is important that you wash those every now and then. That's just something that goes to and from the grocery store. It stays in your car. That's just kind of just a practice every once in a while. Just toss them in the washing machine. And then that way you'll make sure that they stay clean as well. And then also the last thing is if you're going to run errands after you grocery shop or if something comes up, I always try to keep one of those like hot, cold, they're like bags that you can find at the grocery store in my car, just in case I have gone shopping got cold items and then something came up and I had to stay out longer than I thought. That way, you know, you really don't want stuff to sit out for more than like 45 minutes, 30, 45 minutes to an hour without actually putting it back in the refrigerator. So those are something easy that you can just fold down and keep in your car if the situation comes up. And then I also, one final thing I meant to say, a lot of people have questions about if I should buy like organic produce or not organic produce. It's totally up to personal preference. The food itself is gonna pretty much have like the same fiber, vitamin, and mineral content. It's just that the organic produce would have been processed with pesticides compared to like your conventional produce. It can get expensive. So I use the rule of thumb a lot of times. If I'm going to take the peel off the outside, so like an orange or a pineapple or something like that, then you don't necessarily have to get it organic, but something like a strawberry or grapes or some of your lettuces that you aren't going to take the outside off, I would definitely, you know, consider getting those organic, or at least washing them, you know, and you don't even have to use like a produce wash or soap or anything like that, but just washing them well when you get them home. I know that's not on there, but that was just a side thing. So I just wanted to leave y'all with a couple challenges and like a couple thoughts, kind of as we're still early in the week. So if you have to do something later on in the week, I know it's hot outside, but there are a lot of different farmers markets around the state. So, you know, I think that's a great way to get out and get to know the different farmers that are local to you. Also, a lot of stuff is in season right now. Try to make a plant-based protein meal. So whether it's making a salad with some beans on it, or making this winter, trying to do like a vegetarian chili or something like that. And then the third one is try to cook with a vegetable or a fruit that you haven't used before. So, you know, next time you shop, like be intentional of like walking around the produce aisle, maybe trying to identify something you haven't seen before. I feel like a lot of times we walk in the grocery store and we're very just like, this is what I need, this is where I need to go. And so just take the time to kind of look around and see what other options are out there. And you might actually find a new brand or something new to try that you haven't before. So yeah. So I hope this was helpful to y'all. And then I have some references back here. There are a lot of great websites out there that you can find. You know, a quick search can be a good kind of reminder of what to do when you're shopping. And they also have a lot of printable like list templates out there where you can kind of print off. It just says grocery list, and then it has the different categories, and then you can go in and fill what you need just to kind of keep you on track while you're shopping.
Thank you, Mary Parker. We did have some questions come in. I quickly do want to mention, though, that next week we will have our next cooking demo on Tuesday, the 23rd, I believe, at 11 o'clock, and it will be on summer salads. So if you're interested in hearing some recipes using more plant-based produce, definitely tune into that, and you can register on our website, cscatlanta.org. We hope that you'll join us. Okay, I have a question about rotisserie chicken. Is it healthy as baked chicken, as healthy as baked chicken?
So with the rotisserie chicken, it's definitely a convenience item. It is baked. It's just like a rotisserie style where it spins. So that's the way it gets its name. You do want to remove the skin when you eat the rotisserie chicken, just because the skin is going to be your source of saturated fat. So that would be my main thing, is if you did buy a rotisserie chicken, just to peel off the fat or peel off the skin before you ate it. I know some places may inject the chicken with some different seasonings or flavorings. So it's really, up to you as to which type you want. But I usually like to get their plain original one and then take the skin off, and you can shred it for different purposes throughout over the course of the next few days at home.
And we had one person that was going to unmute themselves. Vera, go ahead.
Oh, yes. Hi. I found this session to be very helpful. My question is regarding salt in the diet, and how I had an episode where I had a nosebleed and found out that my blood pressure was high, and kind of gave it some deep thought and realized that I had purchased food, like the previous day I had purchased food at different restaurants because I'm a caregiver and I don't want to cook every day. So that shocked me, and I was determined to start watching my salt intake. So everything has so much salt, even a piece of bread. If you have 2 pieces of bread and the sandwiches, I had bought a half a sandwich from Publix and they said, and I looked at the nutrition information, it was 1,400 milligrams. And that was without cheese. I've been invited to a cancer support group picnic from Jason's Deli, and I looked to see how much the ham sandwich, it was, we could choose a ham or turkey sandwich or veggie wrap. I had to wind up taking a veggie wrap because both of them were 1,400 milligrams of salt. So how do we, to me, it's a challenge. I don't want to cook every day, but it seems like that's going to be my lot, to try to cut down on salt, across the spectrum. Because like I said, even bread, anything in your kitchen, rotisserie chicken, or even some unless you're frozen vegetables, those don't have too much salt. But it really kind of, a pizza, I haven't had a pizza in 3 months because of the salt. So what do you advise on that? Because that's bad for the heart too, and the blood pressure, how much salt is in the American diet.
Yeah, I know. You got it. Okay.
Thank you.
So I know that it is difficult when you're trying to limit something like that. And like you said, a lot of the, not just a lot of food in general, like you said, even if you wanted to make a sandwich at home, bread has salt in it. So, I think that it's whether, if you can, I know you said you don't like to cook a lot, but it may be more of meal prep, or even if I call it kind of batch cooking. So let's say you yourself made some baked chicken breast for the week, then you could pair it with different things. So you could pair it with some brown rice, and you could pair it with some veggies that you do yourself and kind of make a stir fry bowl. So again, it's navigating, like you said, because cheese does have salt in it, and then your bread does have salt. So for your pizza, it may be that you have a slice, but then you fill up, if you're still hungry after that one slice, then you have some sort of side salad, or some veggies or something along those lines, in addition to that one slice, instead of filling up just on the pizza itself. Another thing that you can do is get veggies added to your pizza instead of having the ham or the sausage or the pepperoni. A lot of times those processed meats, you found out when you went to the luncheon, that your nitrates and nitrites are actually sodium nitrate and sodium nitrite. So that's why a lot of your processed foods have more salt. So I think the biggest thing that I could recommend would be just trying to, plan ahead and, maybe bake something or make something and then freeze part of it so that you can pull out at a later date, so you don't feel like you're having to make something all over again yourself. They do make a low sodium bread that you can find. Or it may be getting something like some unsalted crackers, unsalted whole wheat crackers, to have kind of as your substitute if you want like a crunch or something during the meal.
Yeah, that sounds great. And I guess that's the same idea you'd recommend for like lunch ideas in place of lunch meat, like you said, because I got some low sodium from Publix roast beef and low sodium, they taste terrible, low sodium turkey. So I think, like you said, the batch cooking and kind of use those for healthy lunch ideas rather than lunch meat. Thank you.
Yeah, thank you.
All right. We had one more question. My aromatase inhibitor side effect is a raised cholesterol. So my cholesterol went up for the first time. What is the number one thing to do to get that down?
So I think there's not one like set, this is what you have to do. I think it's like a combination of things. So it's going to be, trying to be physically active as, what's within like your ability to do. And then also trying to incorporate plenty of foods that have fiber in them, like your fruits and vegetables, as well as cooking and incorporating those foods that have omega-3 fatty acids in them. So that's going to be your healthy fats that you may find in your tuna, salmon, also like an olive oil based dressing, or incorporating just like a handful of nuts as a snack. Those would be kind of the three components, but it's not just one thing. It's going to be a combination of both diet and physical activity that's going to help your cholesterol levels come down.
All right. Thank you so much. Do we have any other questions? Feel free to put those in the chat. Also wanted to mention that we are recording today's session, so that will be available on our website, cscatlanta.org. And we will also share the PowerPoint presentation as well on our website.
I had one more question. Like you said, don't the requirement or the healthy requirement in terms of sugar is 6 teaspoons, if I understood you correctly, 6 teaspoons for women per day or no more. On the food labels, it's not typically, and if I'm not mistaken, listed as teaspoons. I think they're like grams of sugar, if I'm not mistaken. How do we know what 6 teaspoons of sugar, are?
The question is, Mary Parker, how do we know what 16 teaspoons of sugar are?
So with that, for you kind of have to think about it in, hold on, let me go back to that slide. Sorry. Okay. So you can see that for down at the bottom of the slide, no more than 36 grams per day of added sugar for men, no more than 25 grams per day of added sugar per women. Okay. So next to that, 25 grams is equal to roughly about 6 teaspoons. And then 36 grams is equal to 9 teaspoons. So like if you have coffee or tea in the morning, instead of using like an actual spoon, if you're wanting to be conscious of how much added sugar you're putting in your coffee, I would maybe use an actual like teaspoon. And then you can say, okay, I'm putting 2 teaspoons in here. But, I think a lot of the only time that you're, that's how you would know to get back to your question, that's how you would know where it says included 10 grams of added sugars. So that means that in 2/3 cup of this product, you have 10 grams of added sugar. So that's how you would know, okay, well, I had 10 for the day. So according to the American Heart Association, I've met my recommended limit. I I wouldn't like hyper focus on that unless you're worried about your blood sugar or limiting just foods with added sugar. But again, I'm actually not even sure what this label is. So it's just something if you're looking to get a new cereal, a new like granola. Sometimes the granolas can have a lot of added sugar in them. Also any sort of like fruit juice that's not 100% fruit juice, that can be a source of added sugar, or any of those like bottle, like pre-made, like a pre-made smoothie drink or something like that. But that is where you would find it. So no, just for men, it'd be no more than 36 grams a day. And for women, it'd be about 25 for your added sugars.
All right. And Sharon, it looked like you had your hand raised. Did you have a question?
I do. I jumped in here about 12:25, so I missed some of it. And the report about the added sugars, you might have already said this, but let me just ask you. So are you set? So let's just say I have plain yogurt in the morning with no sugar, and then I have fruit with that, strawberries and blueberries. So they have their own sugar. So that's okay because it doesn't have the added sugars. I just want to make sure I'm understanding that correctly. Is it the added sugars that's part of the 25 grams per day?
So the question was blueberries that have added sugar. What, I'm sorry?
I guess what I'm saying is if I've got natural fruit, does the natural fruit part of that added sugars on the label?
Oh, when on the label, if it says it has added fruit.
Well, it says added sugar. So is the added sugar representative of the fruit? Or if I put, like if I was to sprinkle sugar on top of the fruit, is that the added sugar they're talking about?
If the labels.
Sugar, does that mean that it's just includes the fruit itself, or that sugar has been added to the fruit?
No, it's well, let's see. So I guess so this is going to be like added. This is more of like added sugars outside of like the natural sugars that you find in fruit. So depending upon what it is, I mean, I know fructose is, but I wouldn't worry so much about I wouldn't worry about the natural sugars that come from fruit, as opposed to something that where they've added high fructose corn syrup to something.
Okay, I understand.
All right. Well, if there aren't any further questions, thank you all for joining us today. Again, we do have these nutrition seminars every month. And next week we will have our cooking demo on summer salads. So we invite you to join us for that next Tuesday. And we hope you all have a wonderful rest of your day. Thank you so much, Murray Parker, for volunteering your time to do this program.
Yeah, thanks for having me.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.